name is Dr. Ron Peek, and I'm a chiropractor in Mount Laurel, New Jersey. What you're watching today is one of a series of self-help videos that we've created for the patients in our office so that they can supplement the care they receive and increase the benefit they receive in the office. If you're not a patient and you're watching this video, you're welcome to hopefully utilize some of this information, and I hope it's helpful to you. Today we're going to talk about the use of ice and heat, hot and cold. And I find that even though that's a very simple topic, it's a topic in which there's lots of confusion, and there's one significant error that people frequently make that I really want to address today. You know, if you talk to 10 different experts about ice and heat, you frequently will get 10 different opinions. So really all you're getting today is my opinion based on my experience. The traditional use and recommendation for ice was you use ice for the first 24 hours of an injury, and then you go to heat, etc. That's modified nowadays. Most experts sort of agree that you can use ice certainly longer than 24 hours. And my own opinion, again, my own experience is ice can and should be used as long as there's inflammation and or swelling in an area. So in our office, we have patients using ice for 20 minutes and then take it off, and perhaps use 2 applications a day for on average 3 or 4 days. Again, in a significant injury, you can use it longer. I've had patients use ice for 7 to 10 days and not use any heat at all. Generally, ice application, again, is very safe, and I find it to be very effective, especially with back injuries, neck injuries, which we deal with in our office. Heat's a little different story. The application of heat, one of the problems with heat is it feels good. But when we put heat on an area, the greatest tendency is to leave it on too long. Oftentimes people use a heating pad and leave it on for an hour or longer, or sleep on it, whatever. And again, in my own experience, this is what we recommend. I tell people to use heat for 20 minutes and then take it off for at least an hour, and then you can reapply it. Now the reason for that is very simple. When you put heat on an area, it draws blood into the area, which is good. That promotes healing. However, if you leave heat on too long, it continues to draw blood into that area and causes a congestion in the tissue. That means the tissue literally will swell a little bit more, and you actually can add time onto the healing process. Oftentimes people that overuse heat when they didn't know it will add 2, 3, 4 days to the healing process. So we generally clarify to people like we're talking to you right now and say simply use heat 20 minutes on, take it off for at least an hour, then you can apply it. And I also tell people using heat the same way as we use ice, 2, possibly 3 applications in a day is sufficient. You're not going to speed the process up too much if you use heat or ice too much more frequently. So that's really about it. Main problem again is overuse of heat, too long use of heat, leaving that heating pad on too long, and it adds time to the healing process. You don't want to do that. So we usually don't rotate ice or heat. I know some athletic trainers do that, and it's fine, there's nothing wrong with it, but generally the application of ice to reduce swelling and inflammation in the beginning is sufficient, and later on heat can be used to kind of touch some things up. So if you're not a patient in my office, incidentally, although we hope this has been beneficial to you, I would recommend before you follow this advice, you go see your own doctor and find out what he or she says regarding use of ice and heat. That way we keep all the attorneys happy that are out there. So I hope you found this information enjoyable, informative, and if there's any problems that you've had with your neck, your back, or chronic problems of any nature, I'd like to give our office a call at 856-778-8653. Give us a call and we'll see if we can help you out a little bit. Thank you so much for watching. We'll see you on the next video.